Hi, welcome to That's Ready Mysterious, the show where every bite-sized mystery is rooted in reality. I'm your host, Kelly with an I, leading you through a maze of short stories that are filled with perplexing true mysteries. From missing people to unsolved crimes to eerie coincidences, each episode invites you to step into the unknown and question the ordinary. These tales aren't from fiction, they're stories history hasn't solved. Whether you seek suspense, love curious facts, or are just drawn to stories that linger in your mind, That's Ready Mysterious is your weekly passport into the truly strange, baffling, and unforgettable. Tune in and let the mysteries begin. Transcripts and references for all episodes can be found at that'sreadymysterious.wordpress.com. No apostrophe and no exclamation point. Today's tale is about Morgellons disease. Morgellons disease is a rare condition that is characterized by multicolored hairs protruding from the skin or embedded in the skin or in lesions. Morgellons comes from a disease recognized by Sir Thomas Browne in the 17th century children. In a letter to a friend, he wrote about a pediatric skin condition. The children had harsh hairs on their backs. Morgellons disease can be found around the world but is most prominent in the United States. The majority of the sufferers of Morgellons disease are white, middle-aged women. This has led some to believe that Morgellons is nothing more than a delusional parasitosis or delusional infestation. In other words, they believe it's all in the sufferers' heads. It's easy to write the disease off because most medical research is done on men and women are often not taken seriously. There are numerous symptoms related to Morgellons disease. Patients may develop slow-healing ulcers in the skin or lesions that do not heal. Within those lesions, or protruding from the skin, are multicolored fibers. The fibers can be black, white, red, or blue. Some describe these fibers as looking like synthetic or inorganic materials instead of being hair-like. Patients also often experience chronic or severe fatigue as well as difficulty concentrating and memory problems. They also usually have joint or muscle pain. They suffer from formication or feeling like insects are crawling on, stinging, or biting the skin. They also experience neuropathy or nerve damage that causes weakness, numbness, and pain. The most prominent feature of Morgellons, however, are the fibers that can be found under or protruding from the skin or embedded in lesions. At first, it was believed that Morgellons was a delusional psychological disorder, but more recent studies have shown it might be caused by a tick-borne infection. In some people, the filaments have been made up of keratin and collagen. It's believed that in some cases, the fibers have come from a proliferation of keratinocytes and fibroblasts in epithelial tissue. There are several potential causes of Morgellons disease. Some doctors believe the disease is purely psychological. Some researchers and doctors say it is a form of delusional mental illness. They chalk it up to delusional parasitosis and believe the fibers come from fabrics and other textiles. Others believe that there is an underlying pathogen causing the illness. A 2009 study of 25 patients with Morgellons showed that 23 of them had prior psychiatric diagnoses, including bipolar, attention deficit disorder, obsessive-compulsive disorder, and schizophrenia. A 2012 CDC study of 115 patients did clinical evaluations, analyzed skin and blood samples, and reviewed medical histories and found no common cause. 43% of the biopsied skin lesions had fibrous material in at least one skin lesion. Most of the fiber samples contained cotton. The study identified bacteria or fungi in 19 people. No one in the study tested positive for B. burgdorferi infections, but the study was not looking for this. And although some tests can be effective in finding Borrelia bacteria, they are not accepted diagnostics by the CDC. The study concluded that Lyme disease could be a potential cause of Morgellons. However, the relationship between the two diseases is still controversial. The first reports of Lyme disease in the United States were in the 1970s, but Morgellons didn't appear until 2001. Thomas Brown, however, described hair-like protrusions coupled with the sensations associated with Morgellons in the 17th century. It is possible Morgellons has been around for that long. The earliest known case of Lyme was in a 5,300-year-old mummy. It's possible Morgellons has been around for much longer than believed and went unrecognized. A 2015 study found B. burgdorferi, the spirochete bacterium that causes Lyme disease, in 24 of the 25 patients included in the study. They examined skin samples, many containing fiber-like materials. Researchers found the fibers contained human skin cells, suggesting the fibers come from hair follicles, not fabric. In 2017, a 30-year-old woman claiming to have Morgellons was a case study. She reported having skin lesions on her arms, hands, and chin lasting 2 months. She also had fibrous protrusions under her skin. She did not show signs of having a B. burgdorferi infection and was advised to seek psychiatric help. In a 2018 study of 1,000 patients with Lyme disease, it was discovered that 6% had Morgellons disease. 77% had at least one other infection. Overall, studies have shown that B. burgdorferi is the most common infective agent related to Morgellons, but other species of Borrelia have also been found. A 2020 report said that Morgellons disease can look similar to Ekbom's syndrome or delusional parasitosis. This is a psychiatric condition where a person believes they have a parasite infection when they don't. According to 2009 data, Morgellons disease affects about 14,000 people worldwide. It is not easy to diagnose Morgellons disease because there is no diagnostic criteria for the disease. A doctor might do a skin biopsy to look for fibers, and even if they do find some fibers, they often do not find an underlying infectious agent. If they do find fiber-like materials in the lesions, they may send the biopsy out to a lab for further study. Morgellons might be diagnosed if the patient has slow-healing skin lesions and skin-crawling sensations. Blood and skin samples might show signs of bacterial infection, possibly involving B. burgdorferi. The Borrelia bacteria has been found in some skin and tissue samples. Borrelia burgdorferi was found in dermatological tissue taken from the lesions of 4 North American patients. Borrelia garnii was found in the tissue taken from 1 Australian patient. A larger study found Borrelia in 24 of 25 subjects. Borrelia was found in lesions by 4 different labs, proving that the outcome is repeatable. The spiral bacteria Borrelia was found to be alive. Although Borrelia is common in the lesions, the etiology of Morgellons is believed to be multifactorial. Spiral bacteria has been found in dermatological tissue taken from patients who have been treated with antibiotics. There is no standard treatment for Morgellons disease. The treatment varies depending on the underlying cause. In some people, a course of antibiotics is called for if the physician believes the fibers are the result of a bacterial infection or a tick-borne illness. For some people, the physician will prescribe psychiatric medications if they believe the underlying cause is due to a mental health condition. For some people, an antiparasitic is called for. No matter the treatment course, it's important for the patient to have a good relationship with their doctor due to the controversial nature of the disease. The earlier a patient is treated, the better the outcome. Morgellons disease is not considered to be contagious. The 2012 CDC study said that no single infection causes Morgellons. However, a 2018 review of Morgellons studies showed that it may have a more physical cause, which could make it contagious. The review showed that the fibers and lesions were not synthetic materials, but originated from cells deeper within the skin. Some studies showed a correlation between Lyme disease and Morgellons disease. This could mean an infectious agent is responsible for the disease. Both dogs and cattle can also develop lesions related to a similar bacterium. The outlook for someone with Morgellons disease is good. The disease is not life-threatening. They should live a normal lifespan according to their overall health. They will, however, be at higher risk of developing skin infections. Patients should work with their doctors to figure out how to prevent further infections. Some people believe that there could be an underlying genetic condition that contributes to the development of Morgellons disease. The mechanism for coloration is not yet understood. Red has not been figured out at all, and no known textile fibers use blue melanin in their pigmentation. What causes Morgellons disease? Is it purely psychological, or is there more to the story? What do you think? Thank you for joining me on our adventure through today's mystery. The stories that That's Ready Mysterious covers are often stranger than fiction. If you enjoyed today's tale, subscribe to make sure you never miss a story that challenges the ordinary and reveals the mysterious. Until next time, keep questioning, and remember the world is full of mysteries yet to be explored.